I'm Rachel Hopkins and I'm joined by our resident osteopath, Rebecca Wedlake. Hello Rebecca, thanks for coming in and seeing us.
Thank you for having me back.
Yes, so we're going to talk today because there are sometimes when somebody will come along to you and you'll possibly say, I'm unable to treatment at the moment for so many reasons.
Yes.
What would make you make this decision?
Well, it all starts initially, I mean, I'll screen ongoing anyway, but it starts at the first appointment.
Right.
So when you come in, I mean, I'll have a chat with most patients on the phone anyway. So if I think there's anything indicative that I wouldn't even have you come in, so if there was like a medical emergency or I suspected that you had a fracture, for example, as trauma, I might suggest that you go straight to see a doctor. But when you come in, people say to me, well, why is the first appointment? Why does it take an hour? Well, it's because I'm going to sit down and I'm not just going to chat with you about your symptoms that you've come in about. I'm going to do a system-wide, it's a bit like an MOT. So we'll sit down, we'll talk about your signs, your symptoms, what's brought you in. Then I'll have a chat with you about your current medication, you know, get into the health history, and then I go through a system-wide.
Why is this so important?
It helps to get the bigger picture, but it also helps for me to screen you to see, is treatment appropriate? So I'll chat about your cardiovascular health, respiratory system, questions about, you know, bowel movements, genitourinary, gynecological, neurological, endocrine system. It's the whole whack. I mean, fair play to GPs. We get about what? They get, I think, 7 to 10 minutes with you. I get the liberty of an hour. So I can really do a full screening. So, you know, and it might be, there could be cases where someone comes in and I'm able to treat them, but I might think to myself, oh, you know what, you're showing symptoms perhaps of your thyroid being out of balance. In that case, I can still treat you, but I'll refer on. But in some cases, you know...
So you work quite closely with GPs in that respect?
Very much, yeah. I like doing that. I like working closely with, if the consultants are involved. It's a multidisciplinary approach. And I think that's really important.
How would you recognise if somebody's thyroid was perhaps out of sync?
There would be certain symptoms and signs that we'd look for, and I'd ask questions about things like your energy levels, you know, your hair, have you got any thinning, look at your nails. Different things that there would be. There'd be a whole host of symptoms depending on which way it was imbalanced. And of course, you know, I'll ask questions around things like if maybe someone might be anemic, they might not realise that they're anemic. If you come into me and you had certain things, people might get pins and needles or sore muscles, that could be musculoskeletal, that could be neurological, but that could also be perhaps a mineral imbalance or a vitamin imbalance. There's so many things that we have to look for. But there are occasions then when it might not be suitable for treatment, and these are what we call red flags. And
what would a red flag be?
This is where, at the moment, it would be a contraindication to treatment. Now, there are contraindications to manipulation, so which is one of the tools osteopaths use. And manipulation is when you click, on the same wavelength there. So that's where you actually put the joint into a position, put a low or a high amplitude thrust through it to increase range of motion, nutrient exchange, break the pain cycle, and so forth.
Very important, if anybody's going to have that done, though, that they come to somebody like yourself, isn't it?
Yes, some people like to do it when they're not qualified. Exactly. I mean, we go through 4 years of training, so it's really important that you get, I mean, and as an osteopath, for me to say I'm a registered osteopath, I've got to be registered with a General Osteopathic Council. It's really important. Now, for manipulation, contraindications are things like bone pathologies, so it could be metabolic, traumatic, such as a fracture, long-term corticosteroid, osteoporosis, you know, anything. There's certain vascular things as well. We have neurological. It all depends, but those are things that would be manipulation contraindications. There are also red flags for treatment in general. This will be things like temperature over 38 degrees, feeling systemically unwell.
And if somebody's got a high temperature, it shows that they've got a bit of a fever, a virus.
Yes, something's going on that we need to address. It could be things like systemically unwell, unexplained weight loss, things like if you've got cauda equina, which is more of a neurological emergency, and I'll sit down and go with my patients through that because there are signs and symptoms, and if I felt that they had that, I'd refer them straight down to the hospital. I mean, red flags are clinical indications that there is basically possibly a serious underlying condition. If I see those, I look to, and there's quite a few of them. I mean, I've just briefly touched on a couple of them, but those are the ones that we'll look through to refer straight away then.
And, you know, does this happen regularly?
It can happen. I have had some cases where I've had patients come in, sit down with me, and that's why, you know, we do the orthopaedic testing. We do, if I need to do a cardiovascular testing, if I need to listen to your heart, do an abdominal examination. This is why we ask our patients to undress head to toe. We have a look at you. And then if I felt that it was the case, but I never just say to a patient, can't treat you, sorry. I'll sit and say, right, at this time I don't believe treatment is suitable for you. Here are the reasons why. What I'm going to do is recommend that we refer you back to your GP. If I felt it was a medical emergency, so if someone came in with a very high blood pressure, osteopathic treatment at that point in time is not going to be appropriate. It would be immediate medical advice, for example. But if it was something I felt, right, we need to refer you back to, I'll write a letter for the GP for them to have straight away, and I've done that quite a few times.
Are people surprised when they come along to you to find out that the consultation is so intense and that you go into so many details?
A lot of people are like, I didn't realise what you did. And then when you sit and talk through, because we're primary healthcare practitioners, and people are, actually a lot of people are really happy because they say, oh, you know, this is a chance for me to get a bit of an MOT. So it is, and I mean, I love being an osteopath. I absolutely love it. I never have a day where I think, oh, I just love it. And no 2 days are the same.
I suppose as well, going into so much detail, people must really trust you because they come to you with one symptom, maybe you pick up and you look for other things. It must immediately put them at ease.
And I mean, you know, you can't see your own back, for example. And we might be talking to you about other things, could be treating your knee. You turn around and then we see that perhaps you've got a suspect lesion on your back, or perhaps there's a mole or something that we think, right, you know what, we need to refer that through. And to have a patient come back and say thank you because that was this or this is, you know, that's why we train so intensively for 4 years. It's great responsibility. So
are you always scanning people, or do you just leave that in the office, or do you still think they, you know?
I think anybody that knows me knows that, because I'm fascinated by human beings, and we're not symmetrical. Nobody, if you turned us on ourselves, we're not symmetrical. But I will be walking down the street and I'll think to myself, I'm not obvious about it, mind, but I will. You see symptoms and you see signs and symptoms, or you might see characteristics and think to yourself, I think perhaps that person has this. And obviously you don't walk up to them and say that because that would be a bit strange. But.
Yeah, I would imagine so. But I suppose perhaps you can see things in people, perhaps they're not walking correctly,
that's,
bad posture.
Bad posture, a lot about people's jobs and things as well. Like the gentleman that you had in the guest just now, the painting, painters, hairdressers, things like that. I tend to see people come in, they tend to be hunched over, not massively perhaps, but I look for rounded shoulders.
But don't you think generally these days, you know, I've got a 2-year-old, so I'm always bending over her. If I'm washing the dishes, I'm bending over.
Forward.
Most of the things we do are designed to sort of do this, and we need to make that effort to sit upright.
And I mean,
I have to remember to sit upright when I'm interviewing you.
Oh, it's all right, because I can feel myself slouching as well. When you've had a baby, you know, your body makes incredible changes for pregnancy to accommodate this, you know, amazing thing that you're doing. But you have these things like ligament laxity, and you might get bad backs and things, and then some people do afterwards. I
was going to speak to you because, yes, a lot of women do afterwards because of all the hormone changes.
Yes.
Would it be a contraindication if somebody was breastfeeding? Because, of course, until they stop...
I know. To my knowledge, I've not seen it to be a contraindication, but what I would say to everybody's unique and different. So if you are breastfeeding, I've seen in clinic where patients or mum's being treated, and then mum's breastfeeding baby, and then baby's being treated as well, because it can be a lovely bonding for mum and baby. But what I'd say is if you are being treated, just to let your practitioner know, so they can see the whole picture, and then they'll be able to tell you whether it is. I mean, obviously, you wouldn't be treated while you're feeding baby. No. Possibly.
Yeah. Never know.
But everybody's unique.
Yes.
There's no set template for anybody.
No.
And that's why treatment is so unique to you.
Yeah. Oh, thank you, Rebecca. And thanks for coming in again. It's all fascinating, as always. Thank you to all our guests today for joining us. And thank you to everybody at home. And thank you online for tuning in. And we'll see you all again tomorrow. Bye for now.